Hi, mate. You alright? Okay? What's wrong? You choking? Can you talk? Call me.
Hello, my name is Brianna, RN, and I'm your CNA instructor. Let's go ahead and get to the lesson. Today we're going to do the communication process, lesson 1-1. Let's get to it. So when we're talking about communication, in this lesson particularly, I don't want you to feel like we're belittling you or thinking you cannot talk. We have to act as if you do not know how to do anything, as if you were a baby. So we have to break it down piece by piece. You're going to have to talk to a variety of people in the healthcare world, especially as a CNA. You got to talk to nurse, you got to talk to other CNAs, you got to talk to residents. So we're going to learn how to talk to people because it is essential. For instance, if your patient is having trouble breathing, you not know how to talk to someone can impair that patient's life or prevent them from getting the care they need to sustain their life. So given our scenario, the patient has a low oxygen reading of 70 and it's turned his face is turning blue in color, he or she. This is indeed something to tell the charge nurse, but how will you communicate these findings to the nurse so that she understands what you're saying? You might say something like, blah, 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 something that she doesn't even understand or know. You can know what you're saying, but you have to be mindful that other people may not know what you're saying. So let's get on to talk about the sender of those messages. In this scenario, you are needing to tell someone something. So you are the sender at this point. You need to understand different filters that can prevent what you're saying from being understood. These filters can affect the way you are giving it and the way it's being interpreted. Let's talk about the emotional aspect of the sender. You might be upset because it looks so weird. Like, oh my gosh, seeing someone blue in color because they can't breathe if you haven't seen it before. You might be upset with your nurse. You might be angry. Or you might be hollering at her, and that can affect how she's going to receive your message. Just think about it. If you're angry, or if you're angry at someone and that person talks to you, a little part of you is going to tone or ignore some of the things they're saying. Oh, here she go, or oh, here he go. It'll make you tune in and out of that conversation if you're going to be involved. So in a situation where you're trying to talk to somebody, make sure your emotions are at a neutral base. Some people get to skipping words when they're in a panicky mood. He's not breathing, he's not breathing. I mean, that's good, but we want to be calm because, well, actually, that's pretty good. For another example, you might not be able to get those words out on the tongue. So you might say, oh, okay, you can't find your words because you're so emotional, you're scared. And that person you're trying to tell, and that charge nurse, if she's a new just like you, she might not understand what you're trying to say. So that time that she's putting in and trying to understand what you're saying, that's taking time away from that patient. So when you're talking to people, make sure your emotions are at a neutral base. Calm down. It's okay. I'm not trying to override a scary situation. A patient might be dying as being okay. I'm just letting you know that be calm. I hope that helps you understand how your emotions can impair how you are saying what you're saying and how the person that you're talking to is going to understand that. You being emotional can prevent certain words that needs to be said so that you can be understood, the situation to be understood. You're going to be like, what are you talking about? What are you saying? Hey, what? She what? Prevent this prolonged time of understanding what you're saying. Let those emotions be at a neutral base. You might be sad about something that happened in your private life and you bring it to the workplace, and that change of your mood can make you talk low where people can't hear you or understand you. It's like that game of telephone where there's a circle of people and the message is, I like pickles, and everyone is to, it starts as a whisper and it goes around the circle. Hopefully when it gets back to the person who's first, the exact word is, I like pickles, and not I like popcorn, or I don't like pickles, or that filter will be like your ear, that person, what is being heard by that person. And also different other factors like the environment, it being like, we're gonna get on that. The main thing here right now is understand that your emotions can affect the way you are being heard, the way what you're saying. It can come off as if you're not saying what you want to say. Another concept, the language. If I speak English and someone who speaks Spanish is trying to tell me that my patient is not breathing or is turning blue, I might not know what azul in blue azul. I don't speak that language, so whatever they're saying to me is going to sound like they're speaking alien. Again, impairing that time, preventing that patient from getting quality care because the communication is off. So that's a filter that can affect what you're trying to say. If I'm trying to tell you something but you can't understand me because we don't talk the same language, then it's just like two rocks looking at each other. Again, it's going to be like, what are you saying? I don't understand what you're saying. Another concept is semantics. This is the study of the meaning of something. So if in this country everyone knows that this means this, for instance, the phrase "that's what's up" means that's good versus there was something in the air. This is important because this helps us know this is a pen. Everyone should know that this is a pen. Versus if no one knew, if there wasn't a common meaning for it, is that a stick? I mean, is it a branch from a tree? It's sarcasm being used. This in a particular country saying no, you're saying no, but it really means yes. So understanding where the area in which you live and work, that common ground of language, it's built based off a common meaning of a particular word or wording or phrase. That's dope. It's not talking about that's a drug. That's saying that's good. Another concept is your attitude. This is your opinion about someone that affects how your behavior towards them. So if you think someone doesn't do a good job at work, your attitude might be toward them like I don't even want to be around them. I don't even want to talk to them. Like she lazy. I don't deal with lazy people. This can affect the messages too, because something could be taken seriously, and a person, their attitude toward you can impair the severity of how important what is needed to be said is. His breathing is off. Their attitude towards you might be they don't think you're smart enough to do your job. So they might start talking slower than what they in the room down there not breathing, or they're down there saying they can't breathe and they turning blue. This affects the messages that's need to be relayed to the receiver of the information. The culture. Some cultures, another aspect is the culture. Some group of people, they don't like for you to look them in their eyes. So while they're trying to tell you that person is not breathing, or the charge nurse that person's not breathing, and the charge nurse is looking in their eyes, they might stop talking, start getting angry with you. Why are you looking in my eyes? Right in the middle of them saying, they're trying to say there's something going on. So in the middle of them saying there's something, and then the nurse is looking in the eye like, what's going on? And they stop talking like, oh, I'm sorry, do you understand how our culture's belief in something can affect the delivery of a message? Another concept is the role expectation. You're not going to tell this information to another patient. This needs to go to the right personnel, the charge nurse. Someone's having trouble breathing, that's who you go to. You're not going to go to housekeeping and say, the patient is not breathing. As a CNA, no. You go to the charge nurse. Another concept is nonverbal messages. So you could be pretending that something's going on to try to get, someone out your hair. Let's use this as a better example. Let's say you're dealing with a deaf, or this patient just got new hearing aids, and you don't want to be shouting so loud because you're right there. I guess you're talking to them in a lower tone and voice, and someone just want to know, did you do something? So instead of you saying yes, you could say yes, but I'm trying to give you an example of nonverbal messages. Thumbs up. Another concept is gender-specific focus. Us as girls, as women, excuse me, when we get to talk to other girls, we get into that feminine energy. Girl, yes, versus talking to a man, it's more, or should be more conservative. Hey, Brianna, the patient in room so saying they can't breathe. Versus if it's a man, you might start off with, sir, there's something going on in this room. There is a difference a lot when how a female talk to females versus a female talking to a man, and a man talking to a woman. They're different. It's different. You might find out that you like this particular male when you're working with them. That doesn't need to be going on, but it does happen. So the way you talk to them might be different from the way you talk to someone you don't like in that manner. But this can affect the delivery of your message too. You liking that person, you might take too long to get that message out, versus someone that's not that is more quicker. Because you need to understand the different filters. All these filters can affect what you're saying or what you're trying to tell someone. Let's jump back on the nonverbal messages. Refer to your body language. If you're talking to me and but your body language is looking like you really don't want to talk to me, that can affect what you're saying too. Because you might get interrupted and say, is there something wrong? If I get a question, are you okay? Your facial expressions. If I'm telling someone I like you, and I have a facial expression that says I don't like you, like I'm being fake, I like you. I like you. Another concept of tone of voice. Did you see the tone? I like you. I like you. That matters. If someone is in a hectic, can't breathe, that tone will be, oh, he's saying he can't breathe, versus if it's saying he's saying he can't breathe, someone take that as if it's not really that serious. Though in the manner, all that is, but I could be dealing with someone, right now that needs me, right now, and how you're saying this patient needs me. They saying they can't breathe. That means the charge nurse, if I hear that, I'm going to check on my patient, but based off how you presented the information, it's going to make, okay, it's not this. I'm coming here in a little bit. Versus if he said he can't breathe, you're turning blue. Okay, I'm dropping. This patient is not my priority right now. Then I gotta go. The pace, how fast you're saying it. They say they can't breathe versus they saying they can't breathe. Hey, to me, this might sound like, it's another episode. Not saying it's not important, but if I'm dealing with it, okay, it's not that bad then. So a little activity to go with the pace. If I'm holding a pen, they saying they can't breathe versus they saying they can't breathe. Your body language can say more than your words, so that is very important to know. Again, like that scenario, if you're saying they saying they can't breathe, that's gonna make me as a nurse say, okay, well, it's not that serious then, because how she said it. If your body language is showing that what you are saying is not that important, it can be taken as such. We don't want to lose the receiver's attention. So if you're needing that nurse to come to that patient quickly, you need to respond or communicate with the use of your body language, if you're going to use it, in a manner that's saying, hey, I need you here. All right, let's talk about the barriers. So we on the sender, say that if it's you having to tell somebody, but let's talk about those barriers. So let's say I need my patient needs help. Different barriers that can prevent that message from being understood by the receiver are the loud noise in the background. If you're looking at, you get their attention to know that you're trying to talk to them, because the receiver has those same filters as you do, is the person that you need to talk to around. Go to the nurse station and say, well, I went to the nurse station, I said in the air, my patient needs help, but no one was there. Because that's a barrier, no one heard you. Another thing, don't assume that everyone knows what you're saying. Talk with common language that is commonly used in your environment, that you know for sure that they know this. You have to understand everyone is unique. They have their own IQ, level of intelligence. It's different from everyone. Are not on the same IQ level. You might find some people that are right there with you, but it's important to know there's millions of humans. Okay, everyone is not on the same IQ level. For an example, if you ask a person who has never used the internet to Google it, they will have no idea of what that means. So those barriers are, in a sense, those filters that's impairing the message from being understood. So one filter, they heard you, they hear you talking to them, but a barrier, they don't understand what you're saying. So it's important to know when there is a barrier in the communication process, to be able to find it, tackle it, and deal with it, or make it not a barrier anymore. So if they don't understand what you're saying, even though they're hearing you talk, to break that misunderstanding, get an interpreter if they speak a different language. If you're using your hands, that's a body language. Hey, or a person who's not understanding of that, of using your hands to talk, they might think you're trying to hit them. Okay, the filter there, they see you trying to get their attention, but a barrier is they're thinking that you're trying to hit them. So you see that, but oh no, I'm not trying to hit you. Another example would be like if someone's saying they're going to hit you. Filter would be, okay, well, you heard them say they're going to hit you. The barrier will be they're not actually hitting you. I thought you said you was going to hit me. Versus them actually coming up to hit you. Which one's going to make you more responsive? I try to use that as a way to get you to understand the different the filters versus the barriers. The filters is what that could potentially be a factor into why things are not being understood. Versus the barrier, this is exactly what's causing this message to not be understood. Them saying they're going to hit you like they're lying. Versus them actually doing, oh, they're trying to make a believe out of you. Try to make that click things. I love my scenario that I gave you. Imagine you are all Barbie dolls. Each doll speaks a different language. How do you communicate with the other dolls about being hungry? What makes this easier would be that the same language is spoken and the same expressions are used. With that help, how do you say I'm hungry without coming off as rude or not being hungry? So you can say I'm hungry. That sarcasm can make a person like, girl, you're not hungry. So when you're talking to people, it's best to come off, or not come off, but act as if they wouldn't know what you're saying. So you have to say it in a way that could be very easy for them. There's no way that they can't understand this. So I'm talking to a CNA who is look a little stressed, or let's say they're angry. I'm going to look at them. I'm going to look at their body language. I'm going to pay attention to their tone when they talk to me. And instead of me coming to them with a tone that might make them even more angry, I'm going to go the opposite direction. I'm going to say, hey, do you mind if I ask you to do this? Instead of saying, hey, I need you to go do this. I mean, no, one of those was bad. Let's make it bad. Instead of using this CNA who's a little frustrated to get this delegated to, I'm going to use somebody else. The nurses, doctors, and other CNAs, they're going to assess to look at the way that they should talk to you. If you're coming off as not being able to understand fast, they're going to talk to you in a manner that's going to get that message across. The way we talk to a baby is going to be different from how we talk to our toddler. A baby went, ooh, cuckoo gaga, versus a toddler, hey, let's do arts and crafts today. Versus a adult, hey, you want to go to the park today? You're taking in the developmental level, all that. When you look at a person, you'll know how you should talk to somebody, or should know. And this lesson to help you get that concept better. So the way information is provided to a patient or to anyone you're talking to is gathered based off the person's developmental level. You're gonna know if you're talking to someone who's 30 but they're acting like an 8-year-old. You're gonna know. Someone say, oh, he's 30, he's acting like this, or he's talking like this, or he's reasoning like this. Let's say that you're 30, you know that you eat with a fork. Okay, let's say another person's 30 but they're trying to eat with a stick or their shoe. You're gathering a person's body language. You're gathering how they interact with you to be able to talk to them. It's okay to talk to somebody who's not at the developmental level that is required. It's okay. You have to know how to talk to them. You can't be rude to them because they can't understand you fast. That's why you're adapting that communication process for specific to who you're talking to. An example, a nursing assistant may ask a cognitive intact person, hey, what do you want for lunch? And that person's going to ask, hey, I want a pizza. But to a person whose cognitive is impaired, their cognitive function is impaired, the CNA may offer a choice, hey, do you want soup or do you want a sandwich for lunch? This allows that cognitive impaired patient be able to make a choice on what they want without being confused or overwhelmed, because they have a right to choose what they want to eat. He don't know about I'm going to feed him this. No, that's not what we're doing. That's not what you're going to do. But that cognitive impaired patient, they need to feel like they are human. Give them a choice if they can't decide on their own, because they typically sometimes can't. So observe the person that you're talking to. Do they speak the same language? Are they in the same culture as you? If not, you should have some kind of research on different cultures. If they're Spanish, or if you know not to look at a person's eyes, certain cultural people's eyes, and you just adapt how you talk based off who you're talking to. The communication process is you. Okay, you have a message and you're trying to get it to the receiver. If the receiver gets the message in a good way, there's going to be feedback, and that feedback will let you know either to continue your talking in that continue that dialogue, or if it's the receiver did not understand, there's going to be feedback too. There's going to let you know they didn't understand. If you don't understand what someone is saying, you need to let them know. I'd hate for me to talk to you and you make me feel like you understood what I said, and when I go and check behind you, you did not do anything I asked. If you don't understand what's being asked, you need to make that known. I don't understand. Can you better break it down for me? Now we're going to talk about the communication styles. There's 3 types. Passive. The passive one is you letting people run over you. You're a yes to everything. Yeah. Even though you don't even want to do it. Yeah. Well. Yeah. You're putting the rights of others before your own. Everyone has a right to choose what they want to do, but you putting yours below everybody else's. Hey, you might want to take lunch first. But instead of you saying that, someone's like, I'm taking lunch first. You say, instead of being assertive communications or using that style, you say, hey, I want to go to lunch first. Do you mind? Passive. Okay. You know you're hungry. You don't in the passive communication style, you don't speak up when you feel wrong. And listen, new CNAs, if you haven't worked had any kind of dealings with the healthcare setting, you might come off as this first off because you knew you don't want to offend anybody. But I'm telling you, you don't have to come in like that. You sound telltale, you sound scared or whiny baby. Okay, yeah, it's yeah every day. You miss nice. I'm not saying be mean. I'm just trying to get you to understand you're nice on everything. Sometimes you're gonna have to tell CNA no, I'm not gonna do your job for you, or no, I'm not gonna do something I'm not supposed to do. No, I'm not gonna go to lunch and I'm not clocked out. No, they might be asking you to run to their house to get something. No. But a passive communication styler. Yeah, sure. Oh, God, Mrs. Nice. All right, let's talk about the aggressive. This person sounds angry. They're advocating for themselves. No, I'm going to break first. I wish I would do that. They're violating the rights of others. They see that you are hungry and tired, instead of saying, hey, it's okay, we go to break. I'm going to lunch first. They communicate in a way that tells others that their feelings don't matter. And you're going to see these, those seniors who've been in this field for a long time. They get very comfortable with their job. They get to get unhumbled. Okay, we don't want to be assertive. We don't want to make people feel bad by trying to be selfish. You're more selfish on this side. You're not caring about other people. Versus the passive, you too care about other people, that you neglect yourself. The assertive is in between both. You respect the rights of others. You stand up for your own ideas and rights when communicating too. They're direct but not insulting. Hey, I'm not about to do your patience while you're on the phone and you're asking me for help, but you're on the phone. Sit down. Or that's not within my scope to do that. I don't feel comfortable doing it. I have to respectfully decline. You're describing the facts. The facts. I can't do that because it's not within my scope. I can't do surgery on this patient. I'm not trained to do that. Versus a passive, yeah, okay, I'll try. Versus an assertive, you gonna do your job and I'm gonna do this. I mean, they're not too wrong, but they're harsh. It's harsh. You don't have to be like that. I mean, some jobs. Okay, so we'll do this. The aggressive would be more so of the DHS coming in. You're going to do this the right way. The passive would be kind of like the patients. Yes, they're not going to say yes to care. The assertive is where you should be. I'm just using it as an example of explaining the balance there. DHS, they're aggressive. You're gonna do this right. Versus the passive, trying to get you to feel of the different weights of the communication styles. So that's a scenario. Let's say you're the CNA constantly leaves work without doing stuff. Okay, a passive wouldn't say nothing about it. Aggressive, you just lazy on your stuff right. They're not stating the facts. They're more opinionated. Versus that passive, they're not opinionated at all, really. It's sort of, I get frustrated with having to come behind you. When there's unfinished, your work is unfinished. There's dirty laying on the floor, the trash hasn't been taken out. I just want to understand what's causing you not to be able to complete your job. You're stating the facts. You're stating how you feel. You're stating that you want an outcome, a better outcome at that. And it's not making them feel bad. If it is making them feel bad, then they should know they're not doing their job. The fact that they're not doing their job right should make them feel bad and not being confronted that their job is not being, it's not good. I mean, how they do their work is not good. A scenario to use, let's say that you, CNA, are wanting to, you're tired, you're hungry, and you want to go on lunch. A passive person will be like, I'm going to let everybody take their lunch first, and I did that before, I'm sorry. Because when you knew, that's how you start out until you learn. I just have to make that known. And you start to learn that no one's appreciating you being nice like that, so you gotta start fending for yourself. A passive person would say, I'm going to let everybody else go to lunch, and when they get done, then you can let me go. A assertive person, CNA, asking, Miss Harris, do you mind if I take lunch first? I'm tired. I finished my rounds. I'm the only nurse here that's done right now. I'm sitting here. Do you mind if I want to take my break? Because I'm really hungry. I'm tired too. Versus an aggressive. I'm taking my lunch first. I don't care what nobody else say. Sorry, I have a Brianna. Ain't she cute? Sorry. I'm back. I'm sorry. So let's talk about the conclusion of the matter. Okay. In order to communicate effectively, we have to be aware of the developmental level of the person being spoken to. Everyone is not on the same level, unfortunately. So we have to be aware of the different filters that can impede the messages we are trying to get across, given a person's developmental level. Using the assertive communication style helps to better relay your messages to anyone in and out of the healthcare field, as well as protecting your rights too. Be assertive. Take a look at that poster below on your handout to understand how to be a better assertive communicator. Use I. Say I. Be direct. Be appreciative as well. Maintain eye contact. Know your boundaries and be consistent. Don't one day say you for not doing some work when they sit down and you do it for Be consistent. Be aware of your body language. Thank you. I hope this helped you better to understand how communication is important, and you're going to be doing it a lot. Thank you.